Assalamu alaikum and a very thoughtful welcome to all of you. I am Dr. Haider A, Assistant Professor in Department of Chemistry. On behalf of Electrochemistry Lab, Membrane and Materials for Sustainable Environment, it is my distinct honor and privilege to extend a warm welcome to our distinguished guests, esteemed members of our faculty, and our cherished students. Let us now formally commence the proceeding of this gathering. To solemnize this occasion, I have the great pleasure of inviting Mr. Rauf Awan and Mr. Taha Ahmed to grace us with the recitation from the Holy Quran and its explanation.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم هو الله الخالق البارئ المصور له الأسماء الحسنى يسبح له ما في السماوات والأرض وهو العزيز الحكيم صدق الله العظيم.
In the name of Allah, the most gracious and the most merciful. He is Allah, the Creator, the Evolver, and the bestower of forms. His are the most beautiful names. Whatever is in the heavens and the earth glorifies Him. He is the Almighty, the All-Wise.
Jazakallah khair. Please join us in standing for the national anthem. I request all the dignitaries to please grace the stage with your presence. Professor Dr. Numan Ahmed, Dr. Nusrat Ashar, Chairperson, Department of Chemistry, Mr. Ghazanfar Hussain, Registrar, NED University, and our distinguished speaker, Professor Dr. Haider A. Khwaja. Since its inception, NED University has stood as more than an institution. It is a living, breathtaking platform for national transformation. Here our gravest challenges are met not with apprehension but with brilliant convergence, and through the discourse of eminent scientists and scholars, tangible solutions are forged. Ladies and gentlemen, esteemed guests and dear colleagues, it is now my distinct privilege to invite a visionary leader to the stage, a leader who fundamentally represents NED University's commitment to action and excellence. Please join me in extending a very warm welcome to the man who provides the strategic direction for this great institution, the Pro-Vice Chancellor of NED University, Professor Dr. Numan Ahmed. Sir, now the floor is yours to share your opening remarks and guide us forward.
Bismillahirrahmanirrahim. Honorable Speaker, Guest Speaker, Professor Dr. Haider A. Khwaja, Hazrat Guru Sain Sahib Registrar, Dr. Nuzhat Arshad, Chair, Department of Chemistry, esteemed faculty members of Chemistry Department, faculty members from other departments, students, ladies and gentlemen. I'm extremely pleased to observe that the Department of Chemistry has organized this very informative lecture. And on behalf of Kennedy University, I extend my heartfelt gratitude to Dr. Khwaja for sparing time and gracing this occasion and sharing his thoughts and ideas about this very important topic that is going to be deliberated this afternoon. We all understand that there are certain types of public goods that this nature has bestowed upon us. And I think clean air is one such public good that we all look forward to using without any kind of hindrance or obstruction. But we find that something as basic, as essential as clean environment appears to be very elusive to us, especially in the present day circumstances, and possibly while living in large megapolis like Karachi. Over the period of time, we have observed that the status of air quality in this metropolis has been declining for various reasons, for various types of backgrounds. One such observation that we come across by way of scientific exploration is that we find that there are many development activities taking place around us. You just walk outside this campus and observe that there is a corridor of transit being developed that we call as the Red Line BRT. And while development in any city is most desirable, sometimes the consequences of development also contribute to pollution. So the suspended particles of dust that you find in this vicinity are significant. And then there are a large number of other developments, initiatives, undertakings that add to this volume of something very undesirable, air pollution. This is not just a predicament of Karachi. Many cities in Pakistan and many cities in South Asia, in fact, experience similar type of challenges. This is something professionally close to my heart also, because being an architect and an urban planner and somebody who is associated with urban and regional planning initiatives across the country, we come across these challenges almost on a day-to-day basis. It was very unfortunate to observe that during the past few years, Karachi and Lahore were competing to basically take the stage of the most polluted city across the globe. And it was rather interesting to see that sometimes Karachi was winning and the other times Lahore was. So something extremely undesirable. Obviously, when we face challenges, we also need to take scientific steps to, in fact, deal with them. And I will just very briefly talk about one such initiative, and that is the Karachi Climate Action Plan, which was prepared by several stakeholders a few years ago. In fact, Kennedy University extended professional contribution, and the overall exercise was spearheaded by Karachi Metropolitan Corporation in association with international organizations like the United Nations Development Programme and a national entity that provided leadership to it, and it was interestingly the urban unit Lahore, Remit of Punjab, that lent a hand of support and collaborated with the government of Sindh, the Karachi Metropolitan Corporation, in order to come up with a very scientific and achievable plan to improve the overall environment of this city. Now, the plan is very much in flux, and under the overall leadership of the Metropolitan Corporation, we hope that the overall environment will go down. One very specific dimension of that plan is the scientific assessment of air quality, and obviously taking mitigating steps in order to put the overall context in order. I'm sure that the learned speakers and the deliberations that are going to follow will dilate upon this subject in greater detail. I once again congratulate the Department of Chemistry, the faculty members, especially Dr. Shazia Parveen and the colleagues and team members in making it possible to hear to this very important discourse, and hope that when we leave today, we will all stand educated. Thank you very much.
Thank you so much for your valuable insight. Now I request Professor Dr. Numan Ahmed to please present bouquet to our esteemed guest, Professor Dr. Haider A. Khwaja. Today we gather to discuss a silent emergency, one that is frequently observed but not fully understood. We see the haze in our skies and hear the health advisories, but how do we move from merely observing a problem to truly comprehending its depth and devising solution? This is precisely why today's talk is essential. We are not merely here to discuss air pollution in theory, we are here to confront the scientific and specific troubling reality of air pollution in Pakistan. We are immensely privileged to have with us an expert who has dedicated his career to this very mission. It is now my great honor to introduce our distinguished keynote speaker, Dr. Haider A. Khwaja. He is an associate professor at the University of Albany, State University of New York, and a senior research scientist at the New York State Department of Health. He brings a wealth of transcontinental insight directly to our stage. With over 95 publications and 3,000 citations, he has transformed atmospheric chemistry into a language of public health urgency, directly connecting pollutants to hospital admissions. Our true pioneer in environmental health sciences, Dr. Haider A. Khwaja.
It is indeed a great honor for me to be a part of you, and thank you so much for kind introduction. Today I am going to discuss about the air pollution problem in Pakistan and a case study in Lahore. Today's talk, the overview, some background on air pollution, particulate air pollution, Pakistan's air pollution problem, what's causing this, breathing, what's at stake, knowledge gaps, and a case study in Lahore, some key findings, and what can we do on an individual basis as a community, scientific community, and authorities. The million-dollar question is why should we care about air pollution? Air pollution is a significant, is a major public health problem in developed and developing countries. Air pollution now the second highest cause of death.
बस एक उसका शॉट लेना और खत्म 5 सेकंड का
Second highest cause of death, trailing the high blood pressure. According to this recent report in 2025, air pollution contributes the more than 7.9 million deaths and about 275 million healthy life years lost on a global basis, and it is costing us about $4.6 trillion on an annual basis. And if there is a status quo, then this cost would increase to $80 to $25 trillion by 2060. More than 2/3 of the air pollution deaths, the lost life years, and the cost is in the Asian countries, particularly Pakistan, India, Bangladesh, and China. And the cost, about 2/3 of the total cost, we are burdening on us. What are the consequences? The consequences of air pollution are haze, smog, reduced visibility, now climate change, big problem, impact on aquatic ecosystems, and more importantly, impact on human health. Does the air pollution contribute to adverse health effects? And the answer, the big answer is yes. Why are we giving so much importance on particulate air pollution? International Agency for Research on Cancer, IARC, they have classified outdoor air pollution as carcinogenic to humans, that is group 1. The particulate matter, which is a major component of outdoor air pollution, has also been classified as carcinogenic to humans, that is group 1. Here I am showing you the PM2.5. You can see here the molecules about 0.01 micrometer, virus is about 0.1 micrometer, bacteria 1 micrometer, our hair is about 50 to 70 micrometer, which we can see through the naked eye. PM2.5 particulate matter less than 2.5 micrometer. They are embedded with organic pollutants, PHs, ECBs, dioxins, trace metals, coming from fossil fuel combustion, the vehicle traffic, construction activities. All these pollutants, they are attached with these fine particles, PM2.5. Gaseous pollutants, when we inhale gaseous pollutants, they are soluble in water and they could be taken away from our upper airways. On the other hand, the fine particles, they can penetrate deep into the lungs, they can go into the alveoli, they can go into the bloodstream and can cause number of diseases. A large number of studies, particularly the EPI studies, have been carried out in developed countries, and they have found association between PM2.5 and cardiovascular diseases, pulmonary diseases, mental health, obesity, and most importantly, the neurodegenerative diseases like Alzheimer, dementia, and Parkinson's disease. Pregnancy losses, loss of birth weight, they have found association between PM2.5 and all these diseases. In developing countries, not much work has been carried out. I started a project with the collaboration of Aga Khan University in 2008. What we have done, it was a 3-year study. I got the funding from National Academy of Sciences, collaborated with Aga Khan University. We monitored air pollutants and simultaneously we collected hospital data, emergency room visits and admissions due to cardiovascular diseases from 3 major tertiary care hospitals like Aga Khan University, NICVD and KPMC. So far, we have published more than 10 papers. I have produced 3 PhDs on that work. The condition of air pollution and the health impact is pathetic. The Karachi data, I think, is now the dementia. Dementia is attributed to air pollution, and it has resulted about 626,000 deaths, about 11.6 million healthy year life lost in G23. Pregnancy losses in Asian countries, about 350,000 pregnancy losses. So it is a major concern, it's a public health concern. And in developing countries, I think we need studies like these, the air pollution and what are the impacts on these different diseases. Now the Pakistan, and as Dr. Numan said, we always compete to be in top 3. And Pakistan is the world's 3rd most polluted country in 2024. Some of these major cities like Karachi and Lahore, number 2, number 3, and so on. Okay, and I would say this is not only in the urban centers of Pakistan. In this visit, I traveled quite a bit from Islamabad, GT Road, and all that. All these major cities, I think we have a major problem. Lahore, for the last 7 years, for PM2.5, only 7 days, I think the AQI met the WHO guideline, only for 7 days for the last 5 years. What's causing this? There are many sources. The first one is the growth in population. At the time of independence, 1947, we had 31 million people. Now, I think 280 or 300,000. The population has increased by 8-fold since the independence of Pakistan. The second factor is urbanization. Urbanization has also increased by 11-fold. By year 2030, UN has suggested that 50% of Pakistan's population would be living in urban centers of Pakistan. 50%. That's a big number. So population growth, urbanization, vehicular traffic with limited availability of clean fuel. We have a very high sulfur content, about 50 parts per million. We are still following the Euro 2 and Euro 5. We need to follow Euro 5, and that would be having about 50 parts per million of sulfur. So another problem is the vehicular traffic. Industries. The large industries, power plants, and the brick kilns. Okay. Road and construction activities. The stubble and open waste burning, I would come later on. The transboundary and regional pollution. Open burning of the garbage. I did not see much in Lahore or in other cities, but Karachi, I think wherever you go, the solid waste management is the problem. Open burning of the garbage is very common here. The most important part is the lack of environmental legislation and its enforcement, inadequate transport infrastructure. Among the 20 megacities of the world, Karachi is the only megacity of the world which does not have the mass transit system. Okay. We always compete with India and Delhi. Now, for the last 5 years, they have a mass transit system. So that is another big problem. Weak institutions, lack of skilled research and policy personnel. So all these factors, they have contributed to very high levels of air pollution in major cities of Pakistan with serious health consequences. So what's at stake? about 256,000 deaths in Pakistan and about 163,000 disability adjusted life years. Because of air pollution, the average life expectancy is decreased by about 3.7 to 4.6. And according to this University of Chicago 2023, the residents of Lahore will lose about 7 years of their life. Environmental damage, the transportation and visibility. The important factor which I would like to highlight is the cost. Due to air pollution, how much money are we losing? According to this World Bank, we are losing about $22 billion on an annual basis, which is about 6.5% of our GDP, and $60.3 million is being lost on a single day because of air pollution, the health cost, productivity losses, and all that. In the winter time, a problem is the smog, and this smog has started in 2016. What's happening here that during the smog, we have our Himalayas, low temperature, very stagnant air mass, the boundary layer is quite low. All these pollutants are trapped near the ground and showing us very high concentrations. In addition, there is a stubble burning in both Punjabs, our Punjab as well as the East Punjab, India. They burn agricultural waste because first crop, the rice crop, ends end of October. For wheat crop, they need to burn all these stubble agricultural waste to prepare for the new harvestation. And this is the major problem of smog, that thick layer of pollution envelops in major cities of both Punjabs. The air mass direction is from the northwest. It takes all these pollutants towards the Lahore, then Haryana, and then southeast. So it is enveloping both the Punjabs. This one is the NASA satellite pictures of October 6th. Now, October 6th, not much stubble burning. If you move on to November 1st, little bit, and then in the November 15th and so on until the end of January, lot of these stubble burning in both the West and East Punjab. These are the NASA satellite pictures. The farmers are now getting very smart. What they do is, to avoid the satellite orbits, they burn their agricultural waste after 2 p.m. so that the satellites cannot detect these agricultural burning. Now, a case study of Lahore. Lahore has a population of about 14.5 million, a large industrial base, vehicular traffic, brick kilns. I think it's very common in Punjab, and they are not using the zigzag technology, old-fashioned, old technologies, road dust, construction activities, and this stubble and open burning of waste. And a major problem in Punjab as well as in other cities of Pakistan. So what are the challenges we have? The major problem is there are not many studies, and our EPAs, they talk too much but little action. They do not have skilled people, and the universities are also, I think, lacking studies in this direction. We need to train our undergraduate and graduate students in this area so that we can produce good quality data. We need to find out the source apportionment, where these pollutants are coming from, emission inventories, some EPI studies, some toxicological studies, biological markers, the modeling, and we have to have really good legislation, the implementation. That is another big issue in this country. Control the transboundary transport of pollutants. Both Punjabs have the same problem. Okay. And we know we always blame India and India blames us. We need to discuss, we need to sit down, we need to discuss what are the issues, how can we address this smog problem in both Punjabs. Education of students and health professionals and the general public is also another issue. So I was traveling and then I met one professor at GC University, and he mentioned that, can we do some study? I said, fine, we can do. So we have started this project in Lahore, December 2022. What we are doing is we are monitoring the fine particulate matter, and my main goal was to get some health data from Lahore. For the last 2 or 3 years, I have tried everything, but no luck so far. We did not get any health data. So what we are doing is we are collecting samples for PM2.5. We are chemically analyzing those samples during smog episode as well as after smog episode, just to see the differences. So here is Professor Farrokh, Akhyar Farrokh, Dr. Nimra. So Dr. Farrokh moved from GC University to University of Central Punjab now. This is our system, a small low volume pipe, the PM2.5 filter holders. We are using 47 millimeter 2 micron PTFE membrane filters, and also using quartz, which would be used for organics. The samples were analyzed for PM2.5, non-destructive for black carbon by transmissometer, and I have used some EDXRF techniques for trace method. Okay. So the concentration levels were determined, some temporal variation, source apportionment, and the main target is to get the hospital data and just to see the association between these pollutants and cardiopulmonary diseases. This is my lab there. What we do here, this is the controlled humidity temperature room. We have these filters, condition the filters, then microanalytical barriers. We weigh these filters prior to sampling and after sampling, and these are the samples after the collection of PM2.5. How we determine PM2.5? The mass after sampling, mass before, divided by the volume of air sampled in cubic meter of air. So this is the way we determine PM2.5 mass. Let me share with you some data. This is the during fog, December 22 through February 2nd, 23. On y-axis, you see PM2.5. WHO guideline. WHO guideline is 5 microgram per cubic meter, the red solid line. You can see here, not on a single day, the PM2.5 met the WHO guidelines. Extremely elevated PM2.5 concentrations on a regular basis. The dense fog was somewhere around 10th of January, and the mean PM2.5 concentration was about 262 microgram per cubic meter. Before sampling, and these are the samples after collection during the smog episode. This is the temperature relative humidity during this smog episode. What you can see here that the temperature decreases and the relative humidity increases, and between these two arrows the concentration of PM2.5 was extremely elevated. This is the black carbon concentrations. The black carbon is coming from the fossil fuel, particularly diesel. I have not seen such a high concentration of black carbon if I compare with other major cities of the world. One of the highest concentration of black carbon, as high as about 21 microgram per cubic meter. This is lead. We always claim that the leaded gasoline has been banned, but resuspension of the dust, all the dust, it has lead, where the lead would go. So this is the lead in nanogram per cubic meter, the WHO guideline, that is 500 nanogram per cubic meter, very high concentrations of lead. Lead is a neurotoxin, okay, and it affects the renal, reproductive system, and also the cardiovascular and the pulmonary systems. Negative, carcinogenic, very high concentrations, WHO guideline, solid line, and mean concentration was about 6.5 nanogram per cubic meter. Let me share with you one more matter. Chromium, carcinogenic. Look at this WHO guideline, 0.025 nanogram per cubic meter. Not on probably 1 or 2 days it met the WHO guidelines, but very high concentrations of nickel. This is the summary of our data so far. PM2.5, mean concentration 262 microgram per cubic meter, minimum and maximum black carbon concentrations. Sulfur was the predominant. Sulfur is major source is fossil fuel, oil and coal, very high concentrations. Sulfur followed by chlorine, potassium and all.
Microanalytical barriers, we made these filters prior to sampling and after sampling.
Always you know about air quality index.
These are the
Air quality index is a very an index
how you
which
develop
communicates
PM2.5, the mass after sampling,
and therefore light that
volume.
PM2.5 is between 0 to 12. The quality would be good, that's in green color, the moderate, all that, and the last one is hazardous. During our sampling, during this smog episode, 68% of the days the air quality was hazardous, 31% of the days very unhealthy, and only 1% of the day it was unhealthy. Such a dirty air we are breathing. This is free cigarettes for Lahoris. Okay. So here I found this Berkeley Earth in 2015. According to him, the PM2.5 22 microgram per cubic meter is equivalent to smoking 1 cigarette. The Lahore's AQI was 388. If I convert it it's like smoking 4,453 cigarettes per year. So cigarette smoking is free in Lahore due to air pollution. And same is the case in Karachi, not too far away. I just wanted to see whether these trace elements coming from the natural sources or from the anthropogenic sources, from the man-made activities. The best thing to do is to do the enrichment factor. If the enrichment factor is greater than 1, that means the source is anthropogenic, okay, from the man-made activities. So I use the aluminum as a reference, which is a crustal element. You can see here that the sulfur, chlorine, copper, zinc, arsenic, bromine, and lead, all these coming from these anthropogenic sources. People always say, what are the sources? Okay. And if you talk to some authorities, they would say that, well, not much from vehicular traffic, not much from the industrial activities, not much from brick kilns. It is the stubble burning. Not true. 80% of the source is the combination of vehicular traffic, about 30 to 40%, industrial emission, resuspension of the dust, brick kilns. Hardly 12 to 13% comes from the stubble burning. So we have used the EPA model to do the source apportionment. We have found 5 factors, 5 sources. The first source is fossil fuel, that is coal. The markers are black carbon, chlorine, potassium, arsenic, bromine. Second source is oil. Third is vehicular emissions. Fourth is resuspension of the dust and soil. And fifth factor was industrial emissions. Okay. So these are the 5 sources during this smog episode. Now, these are the backward in time trajectories. I wanted to show where these air masses coming from, so that this blame game from both sides could be avoided. Right? So when the concentration was very low, about 115.5 microgram per cubic meter, and as usual during the winter time, the northwesterly air masses, same thing over there, northwesterly. And when the concentration was very high, for 20, I think it's swell from the northwest and also the southwest a little bit, but mostly from the northwest. Since I was really trying to get the hospital data, I did talk to the ex-health minister of Punjab government, and whenever I talked to her or I met, she would say, Dr. Saab, tomorrow you will get the data. And this is about 3 years. And in this visit, same thing, I called her and she said you would get the hospital data. Not yet. And that is my main objective, to look into the linkage between air pollution and some diseases, cardiovascular, pulmonary, tuberculosis, mental health, all those diseases, just to see whether PM2.5 in Lahore there is an association with any diseases. So what I did here is some risk assessment. Assessment based on non-carcinogenic risk and carcinogenic risk. This is the US EPA model. I calculated the CDI and then the risk of cancer and risk due to non-carcinogenic risk. So if carcinogenic risk is less than 10 to the minus 6, then no cancer risk. If it exceeds 10 to the minus 6, then high cancer risk. If HI is less than 1, no risk due to non-carcinogenic. If it is greater than 1, then harmful health effects. So these are the calculations for risk assessment, non-carcinogenic risk for adults and children, carcinogenic risk for adults and children based on this US EPA model. Very clearly, PM2.5, black carbon, showing very high risk for adults, non-carcinogenic, and as far as the carcinogenic risk is concerned, the PM2.5, black carbon, chromium, and arsenic. Lead is not too far away. Then I thought, let's do how many people prematurely died during this. And here is again the US EPA model to do the expected number of deaths. We found about 1,222 deaths. What did we achieve? Some key findings. Extremely high concentrations of PM2.5, black carbons, and the trace elements. WHO guidelines exceeded the WHO guidelines. Primary sources, non-carcinogenic and carcinogenic risk because of PM2.5, black carbon, chromium, and arsenic. What can we do? People always ask, what can we do? Some people are so daring that they say that we know everything. Okay, so tell us the solutions. Solutions are there. There is a need of political will. If we want to do it, we can do it. On an individual basis, we need to change our behavior. I think behavioral changes is the need of the hour. Individually, what can we do? Stop garbage burning, reduce, reuse, and recycle. Unnecessary travel, carpooling, mass transit system, wear mask during high air pollution days, keep children, the vulnerable populations, the children who are in the developing stages, the elderly, and the women who are expecting babies, they should not go out in those high pollution days. Improve indoor air quality. We should have those plants which can scavenge these pollutants like spider plants, snake, lily, and stay hydrated. And I talked to these physicians, what are you going to recommend? So I think during these high pollution days, the vitamins are recommended, omega-3 fruit fatty acids, and fish oil. So on an individual basis, this is our responsibility. That's what we can do. Community, as a community, we can do. Support local clean air initiatives. Public awareness is needed. Plant and maintain trees, not just plant for photos. Okay. Islamabad, during after Ayub Khan's government, I think some General Saab, he said that we need to have some plants and mulberry plants. So they had those mulberry plants, and then for the last 40, 50 years, there is a big asthma problem in Islamabad. So now they are cutting all those trees, okay, and they are going to plant some other type of trees. We need to have the evergreen trees in major cities of Pakistan. They can trap these particles, they can trap the dust and all those different pollutants. I have come across a recent study in Science, April 25th, 2023, some Indian trees like peepal, neem, mango, and crops like maize, pigeon, pea, and safflower. They are very effective for trapping the pollutants. What scientific community can do? We need to provide good quality data. That is not available. Capacity building is also needed. We need to train our students in this public health field. Okay. Very daily approach is to connect cause and effect of air pollution. Research is needed to find out the sources, the relationship between air pollutants and the health. Need collaboration. The air pollution is a multidisciplinary field. We need to collaborate with other scientists, with other disciplines, and lead outcomes research into policy implementation. Authorities, as I said, political will. The laws are always there. If you talk to some authority, they would say, well, we have all these laws. Where is the implementation? Implementation is not there. Installation of catalytic converters and nationwide adoption of Euro 5 and Euro 6 standard fuels, 50 parts per million of sulfur. We need to provide the happy seeders to these farmers. We can change these agricultural waste for pellets, biogas, fertilizers. Okay. And I have seen for the last 3-4 years unscientific solutions for a scientific problem. What they are doing is they are using those smog towers, okay, big smog towers. They are bringing these so that they can take all the dust out. This is like a bandage. Okay. This is like cutting the grass. You address this problem, after some time it would grow again. These are not the solutions. The other thing I saw is the sprinkling water on roads to settle dust. Okay. They have I think received about 15 units of these water. One unit needs 360,000 liters of water. In this water scarcity country, 360,000 liters of water for one unit. You have 15 units. And studies have shown that using these waters, the PM10, that the larger particles would come down because of the gravitational attraction, but the fine particles, PM2.5, you cannot take away from the atmosphere. Chinese have done these experiments, and they have observed that after 15-20 minutes, PM2.5 concentration came back. Cloud seeding, another gimmick. Okay. Cloud seeding, it does not create new clouds. Whatever the existing cloud is, what they are doing is they are spraying the silver iodide and some salt. And on this trip, I was talking to some director. He said that, well, we are thinking to use dry ice to take care of this. These are not the solution. These are 20th century unscientific solutions for 21st century scientific problem. My final thought, Pakistan is not just a Karachi or Lahore's problem, pollution. It is slowly becoming a major crisis, and solution must start with awareness. It needs awareness, action, and accountability. A dirty air does not need any passport or visa to travel. Right? The lesson is clear. Solution do exist. It is a question of will. I want to acknowledge my department, my university, University of Central Punjab, Dr. Akhyar Farooq, my PhD students, Dr. Kamran, he was my student, Dr. Shadia, Dr. Mirza. Thank you so much for your attention.
Okay, we are now open for question answer session.
Assalamu alaikum, Dr. Saida from Chemistry Department. And first of all, I would like to thank you for this valuable insight and insightful talk. There was too much lesson for us, but one thing I would like to appreciate that we need to change our behavior in order to reduce the pollution. Because I had traveled to European countries. These countries are there is too much neatness and cleanliness over there. Same people, same activities, same needs, same demands, but in some region the cleanliness is maintained, and in some region definitely there is a problem of will. So we need to change our behavior. Pakistan is very beautiful, and some regions are very neat, clean, and less polluted, like upper regions of country, northern areas. But the problem they are suffering is lack of infrastructure over there. The quality of life is not much of that level. Even when we go for tour purpose, we see that we have to face so many problems for traveling. So the thing is, we need to improve our willpower. The governance is needed. Solutions are there. Solutions exist, but behavior matters, and behavior at individual level matters. So thank you. It was really very interesting and insightful talk. Thank you.
I think to mention about the northern areas, it's no longer very clean. This year I started one project in Gilgit and Hunza. I monitored during the winter time, not as dirty as Lahore or Karachi, but it's still not meeting the guidelines. The other problem during the indoor in the Hunza and Gilgit area, another project I started, indoor air pollution. Because of the poverty, I think all these people, they just inside the home, and then the ventilation is not very good, and they are burning old shoes, tires, whatever they can get. Very enclosed system, and the asthma is very prevalent in northern areas, particularly Gilgit and Hunza area. So the project I have started is I'm going to use the spirometer to check the lung functions during our study, some questionnaires. So hopefully next year if I come, so I'm going to share some data with you.
Dr. Khwaja, thank you so much for this lecture. This is Dr. Antul Kayu. I think that our students, they must be very much enthusiastic to contribute in this cause, to participate in the research related to air quality. In Karachi, we have another issue of construction pollution. In University Road is being constructed from last 2-3 years, and everybody who is commuting from this road, they suffer from this pollution. So can you suggest some small projects that our masters or undergraduate students can contribute into? 6 months or 1 year's project that can be done in an by the industrial chemistry students with the limited resources. You see this scenario, you know these situations here. So with limited resources, if you can suggest us some topic, and you give us some time to collaborate with our students, that will be really very good for all of us. And I'm sure that our students will appreciate it.
Very good permission, and whatever I can do, I'm always there. In this trip, ICCPS, I think I have taken 2 PhD students jointly. So same thing we can do here with NED. Take students, I can design some projects, short-term, long-term projects, some instruments I can provide. So that's not the problem. We can do that.
Thank you so much.
जी अस्सलाम मेरा नाम इफ़ा रही है और मैं MS केमिस्ट्री का जो ना फाइनल ईयर स्टूडेंट हूँ। और सर जैसे कि डॉक्टर सईदा ने बताया कि अभी इस कद्दू और पुंजा साइट की जो ना मैंने उनको रेफ़र किया तो मेरा ताल्लुक़ भी उन्हीं से। तो ये जैसे इन्होंने बताया कि आपने भी बताया कि वहाँ पर कोई दूसरा सोर्स तो नहीं है एयर पोल्यूशन का, लेकिन हमारे वहाँ पे जो ना गैस वगैरह है होती नहीं है, तो लोग ज़्यादातर जो ना जो लकड़ी वगैरह वहाँ जलाते हैं। और चूँकि मौसम बहुत ज़्यादा जो ना सर्द होता है वहाँ पर, तो इस वजह से लोगों को जो ना अपने घरों के अंदर हीटिंग के लिए बिल्कुल उसको क्लोज रखना होता है, जिसकी वजह से अस्थमा वगैरह की प्रॉब्लम्स बहुत ज़्यादा हैं। तो यानी कि इस चीज़ को ख़त्म करने के लिए, क्योंकि फॉसिल फ्यूल्स वगैरह जलाते हैं, लकड़ी वगैरह जलाते हैं, तो उसकी वजह से दैट इज़ द ओनली कंट्रीब्यूटर टू रिड्यूस द क्वालिटी ऑफ एयर। Otherwise, there is no other factor which can contribute to reduce the quality of air. तो ये चीज़ तो जो ना इंडिविजुअल लेवल पे हम नहीं कर सकते, तो लिहाजा इसमें भी अगेन गवर्नमेंट की विल चाहिए होगी। और दूसरी बात ये कि डॉक्टर सईदा ने भी बताया कि ह्यूमन बिहेवियर का जो ना चेंज है ना, दैट इज़ वेरी नेसेसरी। लेकिन मैं भी डिफरेंट शहरों में मैंने टाइम गुजारा, और कराची, लाहौर, इस्लामाबाद वगैरह इनमें मैंने टाइम गुजारा। लेकिन मैं आपको इस बात की एश्योरेंस दिलाता हूँ कि वहाँ पर जो बैकवर्ड एरियाज़ में, जो माउंटेनियस रीजन्स में जो लोग रहते हैं, वो उनमें जो है ज़्यादा स्ट्रिक्ट सेंस है एज़ कम्पेयर टू ऐसे लोग जो शहरों में रहते हैं। क्योंकि यहाँ पर लोग जो ना अपने घरों में कचरा गिराते हुए वो साफ करके जो ना दूसरों के घरों में जो ना वो फेंक देते हैं, ये हमने कई बार देखा है। तो अगेन यही कि लोगों को अपना जो है ना वो सिविक सेंस डेवलप करने की ज़रूरत है, और हर एक को रिस्पॉन्सिबल होने की ज़रूरत है। तो इस तरह से हम जो है ना एयर क्वालिटी को बेहतर बनाया जा सकता है। थैंक यू।
That is really true that the civic sense in that region is comparatively better. My mindset was changed after traveling to northern regions. I would like to share that in past I was thinking that why people are traveling from rural region to urban regions. The maid working at my home, she has 3 daughters and they are not going to school. So I was continuously insisting her to bring them from village to city so that they can go to schools. She said to me, no, our culture is there, our roots are there. But when I visited that regions, I thought she is right, because where your roots are, you are associated with your culture. So people should be facilitated in their region to maintain their cultures and their thoughts. So he is absolutely right that people in those regions are much aware with the civic sense than the people living in the city. We are polluting our city and country by our own self. We should be aware of that.
I think you are absolutely right. Let me share mine too. While coming from Lahore to Karachi last week, I was at the airport, Karachi airport, and trying to collect my luggage. One person looked like highly educated, in suited, booted, everything. And he was very close where all these luggage was coming out. He was standing there, and some of my eyes were going here and there. So I saw that he had a cigarette, and cigarette he was not like that, but cigarette like that, and he was taking puffs of that cigarette. And after 2 or 3 puffs, he just dropped that cigarette right there. And so that really bothered a lot. First of all, the smoking in the West and in other countries in public places is not allowed. Number 2, if you really wanted to smoke, just wait for 10 or 15, half an hour. Go outside. Look at the butt of the cigarette right there. It was all clean. So this is the individual behavior. We ought to change our behavior. And this is the educated person. I'm not going to blame somebody who's coming from low socioeconomic background, from dress and everything. He must be coming from middle or upper middle class. I have so many stories like it. Anyway.
सर मेरा क्वेश्चन ये था कि जैसे आपने बोला कि इंडस्ट्रियल जोन है, वहाँ पे रेजिडेंशियल जोन्स भी बने, तो एज अ पर्सनल मैं तो कुछ नहीं कर सकता ना, वो जो गवर्नमेंट पर्सपेक्टिव हुआ कि वहाँ पे बिल्डिंग ऐसा हो कि यहाँ पे रेजिडेंशियल जोन ना हो, तो अब हर बच्चे की अपनी ज़रूरत है। जैसे इसने बोला कि हमें अपना वो देखना चाहिए सेल्फ अपने, कि हम पोल्यूशन ना करें कि ना करें, तो सर जिस बंदे की ज़रूरत है, जैसे मैं बाइक पर आता हूँ, मेरी ज़रूरत है, मैं बाईसाइकिल में तो नहीं आ सकता, मैं इतना ट्रैवल लगे 20 किलोमीटर 22 किलोमीटर ट्रैवल करते हैं, बाईसाइकिल में तो नहीं आ सकता रहा। तो उस चीज़ को देखने के लिए, उसके अलावा इंडस्ट्रियल जोन्स जो हैं वहाँ पर रेजिडेंस नहीं होनी चाहिए, ये सारी चीज़ें तो गवर्नमेंट पर्सपेक्टिव पर आ देखें ना, तो मैं अपना सेल्फ एज अ सेल्फ पर्सन मैं क्या करूँगा सोल।
I think the car cooling or motorbike cooling, if two friends are coming from the same area, use that. I think this city needs the mass transit system. When I was growing up in this area, we had red circular rail. Okay, at that time, I left the country in 1975. Now I come every year or so. The things are deteriorating. This city needs mass transit system, not all these blue line or red line or green line kind of thing. Delhi, same problem as Lahore, the smog problem. They have initiated a very good, just like any city in the west. They are very clean, neat and clean. The mass transit system, they are using it. They have cut down the emission from the vehicular, at least have, could be more. That is the need of the hour, I think. You people should put pressure on the government through social media. Through media plays a very effective role. Use media. Okay? And you people, the young generation, the Gen Z, I think you should use the Instagram and some other things. Right, these are the problems, we need this. These are the problems, we need. Put pressure. US, the Clean Air Act in 1970, okay, and the problem was in 17th, 1800, but they realized in 1970 that we need to implement the Clean Air Act. US government has put money to take care of the air pollution. Do you know how much money they are saving due to health costs? $800 billion on an annual basis due to the health costs, productivity losses and all that. Since 1980, they have saved trillions of dollars. So same thing here, the government should look at the cost benefit. We have the issue, how much we are losing towards the health, how much we are losing due to the productivity losses. Kids are not going to school, people are not going to work, transportation problem, visibility problem. This is a big health cost. So if you address this air pollution problem by providing the mass transit system, or to the industries, tighten some screws there, brick kilns, okay, so you can take care of this. And it could not be solved in 1 or 2 or 3 years. It would take some decades. Thank you very much.
Thank you, Dr. Haider A. Khwaja, for such an informative and interactive session. Okay, moving forward, distinguished guests, esteemed faculty and dear students, as we bring this insightful session to a close, it is my pleasure to invite to the stage a distinguished member of our own faculty whose dedication and scholarly work have been instrumental in making today's event possible. Please join me in a warm round of applause as we invite Dr. Shazia Parveen, Associate Professor, Department of Chemistry, to deliver the vote of thanks and formally conclude the today's proceedings.
Thank you so much, Hira. Honorable Chiefs, Chairperson, esteemed faculty members, respected guests, and my dear students, Assalamu alaikum. On behalf of my department, I would like to extend our sincere gratitude to Dr. Haider A, Khwaja, our distinguished speaker, for delivering an insightful and impactful session on air pollution, public health, and environmental sustainability. This seminar has significantly contributed to enhance awareness and understanding of the critical role of air quality in protecting public health and environmental sustainability. It addresses one of the most pressing challenges of our time, urban air pollution, and its impact on public health. It provides a valuable platform to connect scientific research with real-world policy and community needs. I once again thankful to Dr. Haider for sharing his valuable insights. On behalf of my department, I would also like to extend our sincere gratitude to the Honorable Deans, Chair, respected faculty members of our university for graciously honoring the seminar with their presence. I am also thankful to Sir Vasantar, Registrar at NUD University, and Dr. Hira, Associate Professor in Department of Chemistry, for their support to make all arrangements possible in a very short period of time. We also thank our beloved students for their active engagement, and also thank all participants for their active engagement and valuable contributions to the discussion. Such academic exchanges are vital for strengthening awareness, research capacity, and policy-oriented solutions to pressing environmental challenges. With this, we formally conclude today's seminars and look forward to continued collaboration and knowledge exchange. Thank you.
Thank you so much, Dr. Shazia. Ladies and gentlemen, continuing NAD's tradition of excellence, it is my honor to welcome our esteemed Dean of Faculty of Architecture and Science, Professor Dr. Mirza Mahmood Bey, to present the appreciation of token to our guest speaker. I also request Chairperson Dr. Nuzhat Arshad to join him.